So COVID or no COVID, we orthopedic surgeons were aggressively doing surgery. And this is how we like to spend our day. 50% of our work life is like this. It's just a day in the office. But see how many things go wrong in what you do on a daily basis and what I do on a daily basis. And this is very, very relevant to all of us, to everyone sitting here. There's a twisted neck. There's an unsupported arm. There is a stiff back. There's an awkward wrist position. And we are completely focused and sold out to the job at hand, and we hardly look at what we do with ourselves. And hence this talk, which is so relevant, and I thank my co-author, Dr. Hriday Acharya from Ahmedabad, for his contribution to this research. We put up danger signs when there is, at workplaces and, where there's a cement could fall on your head, or it's a slippery floor, or it's a hot cup. There should be a danger sign in the OR, because that's the only thing that's going to keep us alive to this possibility of us doing wrong to ourselves while we are, discharging our duties. The culprits, of course, are it's essentially the position that spine surgeons have to do surgery in. And that position involves craning your neck down. It involves tightening your trapezius and holding your shoulders up. It involves steadying your body while using your hands. It involves working away from your body, reaching out. Especially nowadays, it involves with endoscopic surgery coming up, hands kept in an awkward position and the head turning around to look beyond everything else into the screen. It does involve, use of force, and if you've had a long day at surgery, you're likely to have fatigued and worn out these areas of your body, and you really don't realize that because it's a good day for you in the office. You've done 6 surgeries, right? So this is not a new problem. If you see the postures of physicians back in the day, many generations before us, they all are awkward postures, and it seems like we're designed for that. A lot has been spoken about it, and it's only in the last 20 years that people have started writing about it. And most international meetings talk about surgeon burnouts and surgeon wear-outs and surgeon physical hazards, because 84% of surgeons that were studied in this first study, big study that came up, had some form of back or neck pain, right? So it has been widely studied. If you just look into literature, it is not a figment of our imagination. Most of the studies say that surgeons are at a higher risk of neck pain and back pain and skeletal problems in general, even hand. The hand muscles, the shoulders, they tend to fatigue, and you can get arthritis. We did this study, within our group, again headed by Dr. Hriday Acharya, where we tried to look for neck pain among spine surgeons, and we sent out a questionnaire to a bunch of people. At least 180 of them wrote back. The questionnaire alluded to demographic data, of course, and the frequency of neck pain, the amount of work hours you do in the OPD, what's your scrub time, and do you use loupes or do you use microscopes? So these were the tenets of the questionnaire. How do you describe your practice? Is it primary practice as a spine surgeon, or it's orthopedic and spine? So we looked at a lot of variables: private practice, hospital-based practice, and do you do robotic surgery? Do you use loupes? Do you use microscopes? Did you have neck complaints? And of course, your number of years into practice and how much time you spend during the work. And in our survey, we had an astonishingly high, and this was restricted to the members of the ASSI. So they were all prolific spine surgeons in the country. 74% of the surgeons surveyed had reported neck pain enough to take NSAIDs or take a day off from work. And 4 surgeons amongst the 180 had actually had surgeries for their neck. Some of them are amongst us right now. Even the world stats are like that. If you look at, the bottom line is very, very, difficult to read. But when you look at all the varieties of professionals that undergo treatment for neck pain, the incidence in general population is 23%. General surgeons, who are our lower cousins, have a 47 to 60% prevalence. And we are 74%, which is a high general prevalence, in the world over. The culprit, of course, aside of your posture and ergonomic deficiencies, is lifestyle. And we also asked how many amongst us exercise, 3 times a week or more. And you can see that there was a statistical significance in the amount of time you spent in your own health, lifestyle, running, walking, jogging, cycling, etc., gym time, which negatively correlated with your neck pain. So people who were fitter or spend more time on fitness complained less of pain. And which is where we keep on saying that surgeons are medical sportsmen, and we need to invest as much in our skill sets as we need to spend in our physical fitness. and it is important for you to be a good surgeon, to be physically fit, and you got to spend time doing that. We also looked at loop versus microscope, and we found once again the loop being a culprit. Loop is a shortcut for microscope. Many of us who don't have access to a microscope like to use loops, and we tend to crane our head over because loop gives you a perpendicular vision, and you have to look down to look at look at the focal point. The main risk factors we found among surgeons were a poor lifestyle, which is a bad work-life balance, and people who use loops. Other studies have also confirmed this, people are slowly moving either to naked eye or then microscopes. So what do we do from here? From here, I think all of us should take home this message, which will, you will want to thank this study for it, because we still are, not on the other side of the hill. You don't want to do prolonged neck flexion in your ORs. Make those arrangements. Make sure that you're taking micro breaks. So a lot of us who still need to work looking down can well afford to put your head down in between your work hours and, try to, rest that trapezius so your neck is well supported. Try to work close to your body. Don't reach out, because that will save your back. And of course, regular physical exercises which allude to endurance and strength. So spend some time in endurance, low impact endurance workouts, and spend some time in upper body strengthening, both of which don't come naturally to us, and we got to take out time to do this. And you got to practice what you preach. So look at your own surgical ergonomics. Make sure that your ergonomic setup in your OR is palatable to your body. And finally, to be able to do this, you must do this. So I hope I get my point across clear. Thank you.